everybody, my name is Ashley Kelly. I'm a student at Northwest Florida State College in Niceville. I'm doing my RN to BSN program. For our leadership class, we had to do some clinical time at a facility of our choice with one of their department heads, so I chose mine on the cardiac floor. Problem we noticed on the floor was that we had some issues with falling and hourly rounding, but that was also hospital-wide. So for my presentation, I'm going to go over a couple of things on hourly rounding. First of all, we had to identify a PICO question. My PICO question was, among adult medical patients in the hospital setting, does hourly rounding as compared to lack of hourly rounding reduce the number of falls during an acute care hospital stay? Hourly rounding is also called intentional or comfort rounding. For this project, the focus group is on nurses, LPNs, CNAs, RNs, as well as physical therapy, any other healthcare professional involved with patient care. We want to implement hourly rounding as a way to promote safety for our patients, and we want to also do this with staff compliance. At the end of this presentation, the objective is to be able to identify at least 4 things that we need to do when we go into the patient's room during hourly rounding. The evidence gathered on this topic is that falls are the largest reported adverse event in all hospitals nationwide. The cost of falls into the year 2020 are expected to exceed $54 billion in the United States alone. Hourly rounding can decrease falls by as much as 50% or more, and that multiple hospitals and research centers have discovered its impact this far. On a couple of different research studies I noticed, I picked 3 studies where I felt that the impact of hourly rounding was large. In one study on a medical surgical floor in a 3-month period of time, for every 1,000 patient days, the fall rate decreased from 7 to 3.8, indicating a fall risk decrease of more than 50%. On 8 hospitals over an 18-month period of time and 1,000 patient days, the fall rate decreased from 4 to 2.6. And again, on an orthopedic medical floor over a 12-month period of time, during 1,000 patient days, the falls rate decreased from 5.4 to 3.9. Hourly rounding should be comprised of attention to pain, the patient's positioning, personal needs, assuring that their call light, their water, food, remote, anything of their personal belongings is within their reach. And we should also complete an environmental safety check. This could be wires that are in the way, could be a tripping hazard, spills, puddles, anything on the floor. We also want to remind our patients that we'll come back and see them within the next hour. If not ourselves, another nurse, CNA, or someone will be in to see them. This will help decrease the fall rate and increase the patient as well as family member satisfaction. As one of the things we can do to provide intervention for this, we can list a hourly rounding log outside of each room that can facilitate communication between all healthcare providers. I've noticed you guys already have a log indicating the input and output and their vital signs, but I came up with another log that you could add to the back of your log indicating pain, position, personal needs, their environment, notifying if you're returned, who went and assessed this patient, and list the comments on here. We also want to look at this log daily, communicate with the rest of our staff so we know, who's been in there, who hasn't been in there, which we can comment on here, or we can go and speak with the nurse. This person needs to come in and see the patient. This is going to promote patient recovery and discourage falls, and we want to keep a log of the statistics on the fall rate on the unit to be able to promote satisfaction between the staff and the patients. So at Bay Medical Center, we have a need for this because there's been a recorded total number of falls this year, 106 falls. 102 of these were on medical surgical floors, and 24 resulted in a patient injury. Over 50%, closer to 60%, occurred due to toileting issues, which is something we can be looking at when we're doing our personal needs check on hourly rounding. As a result of implementing hourly rounding, this improves patient safety and decreases the fall rate. Communication is facilitated amongst staff, and nursing practice is enhanced and more patient-centered as we are being an advocate for this patient. The rounding can be exemplified by nurse managers who are there to support their staff and be able to evaluate each staff's performance and take a look at patient satisfaction and how we can look at reducing lost revenue from patient falls. I want to thank all the nurses for their continued support and hourly rounding on patients. It is hard as nurses to make sure you're in the rooms every hour, so we can always depend on CNAs and other physical therapists and healthcare members to be a part of the team. We as nurses spend the majority of our time with the patients, and we put a huge impact on their life. So we need to encourage and support the patients through the process of hourly rounding. The patients will feel safer being seen at a facility who takes pride in patient safety and shows it. Here's a list of my references. And so now, just as like a little way to make sure that you guys were able to get something from this presentation, I'll have Amanda present as my patient, and Gloria, if you just want to pretend like you're going into the room with her and ask her a few questions about hourly rounding and what kind of things you would ask her when you're in the room.
Would you like for me to stand up, or do you want me to sit here and just read it?
I mean, you can sit there. That's fine.
Okay. Forward, down, left. All right. I'm gonna clean my hands before I go in the room. And I say, how you doing? My name's Gloria.
Okay,
I'm gonna
thank
be
you.
your aide today.
Thank you.
I'm gonna go ahead and get your blood pressure. And I said, do you need it? Do you have any? Do I ask her about pain? Because I thought the nurses would do that.
Just if she needs to be positioned or use the bathroom or anything like that.
Okay.
It'll be
Get
different for CNAs.
Well, okay, I'm all done with your blood pressure. Do you need to use the restroom?
I'm good.
You good?
Should
Okay.
I use the?
No.
Okay.
Yeah, do you need any water, any ice? Do you need a?
I have sweet tea.
Okay. I position the room, get the phone
Amanda.
posters, get the wires all straightened out. And
Sure. Amanda.
All right. Thank you very much for your participation. Do you guys have any questions, comments, anything like that? Okay.
Okay.
Thank
Good
you
job,
for
Gloria.
being here today.
This is a good tool, and thank you for that. We
You're
used to
welcome.
have something similar to this,
Mhm.
and they decided to go computer.
Oh,
But yes,
yeah.
we did do this, and it helped a lot.
Cool. Thank you. All right.
Good
That's all.
job.
Thank you.